Hello and welcome to our channel. In this video we will discuss about what is the ultimate management for PCOD or PCOS, that is polycystic ovarian syndrome or polycystic ovarian disease. So in this video basically we will discuss about what are the natural ways to help. So whole foods are free from artificial sugars, hormones and preservatives. So these foods are as close to natural unprocessed state of possible, and fruits, vegetables, whole grains and legumes are whole foods that you can add to your diet. So first one is balanced carb and protein intake. So let's talk about it. So carbohydrates and proteins both impact your energy and hormone levels. Eating protein stimulates your body and your body to produce insulin. An unprocessed high carbohydrate food can improve your insulin sensitivity, and instead of trying a low carbohydrate diet, focus on getting enough healthy proteins. Plant-based protein sources such as nuts, legumes and whole grains are the best sources from where you can get the balanced amount of carbohydrates and the proteins. Now Next is aim for anti-inflammatory. So PCOD is described as a low-level chronic inflammation. So adding anti-inflammatory foods to your diet can help ease your symptoms. Consider the Mediterranean diet as an option. Olive oil, tomatoes, leafy greens, vegetables, fatty fish like tuna and tree nuts. Some women with PCOS experience heavy bleeding during their periods or menstrual cycle. So this can result in iron deficiency or anemia. So if your doctor has diagnosed you with either condition, so talk with them about how you can up your iron intake. They may recommend adding iron-rich foods such as spinach, eggs and broccoli to your diet. You should not up your iron intake without first consulting your doctor. Too much iron can increase your risk for other complications which are related to PCOD. Next, up your magnesium intake. So almond, cashews, spinach and bananas are PCOD friendly food rich in magnesium. Next, add in some fiber to help with digestion. High in fiber can help improve your digestion. So they are lentils, lima beans, broccoli, Brussels sprouts, pears and avocados they are rich in fibers. Next, cut off coffee. If you are addicted to coffee, so cut that. Remove that from your lifestyle because caffeine consumption may be linked to in estrogen level and hormone behavior. Try boosting your energy with a DEF alternative such as an herbal tea. You can try kombucha's probiotic properties. They may also be beneficial for you. And if you cannot cope without a caffeine boost, so reach for green tea instead. Green tea has been shown to improve insulin resistance. It can also help with the... So before adding more soya to your diet, ask your doctor about the latest research that soya acts like an estrogen in your body. This might help balance hormone if you have PCOD. But there is also evidence that adding soya to your diet could disrupt your endocrine system. So people with a family history of estrogen-related cancer, such as some breast cancers, should avoid soya products. If your doctor approves adding soya to your diet, so consider soya milk, tofu, miso and tempeh. They are good foods in order to get optimum. So supplements claim to help this with hormone regulation, insulin resistance and inflammation which is associated with PCOD. So first one is Inositol. So Inositol is a B vitamin that can help improve insulin resistance. It is also been found to help with fertility in some cases of PCOD. Second, cinnamon. Cinnamon comes from the bark of the cinnamon tree. So cinnamon extract has been showed to have a positive effect on the insulin resistance. So cinnamon may also regulate menstruation for women with PCOD. Next is a turmeric. So turmeric is an active ingredient in the turmeric that is called curcumin, and it promising for decreasing insulin resistance and as an anti-inflammatory agent, that is turmeric. Next is a zinc. Zinc is a trace element that can boost fertility and your immune system. So excessive or unwanted hair growth and alopecia. If you have these problems, so you can continue zinc supplements. Next, evening primrose oil. So evening primrose oil have been used to help with the period pain and irregular menstruations. It improves cholesterol levels and oxidative stress, and both of which are linked to PCOD. Next, combined vitamin D and calcium. Calcium, that is vitamin D, is a hormone that is vital to your endocrine system. Vitamin D deficiency is in women with PCOD, and vitamin D and calcium may help in irregular periods and help you to ovulate. So see here, vitamin D is very essential for the people who are suffering from PCOD problem. Next supplement is a cod liver oil. So cod liver oil contains vitamin D and vitamin A, as well as a high amount of omega-3 fatty acids. So these acids can help menstrual irregularities, your menses become regular, and help get rid of fat around your waist. To treat PCOD is Adaptogen Herbs. So let's talk about Adaptogen Herbs and their role for treating PCOD. So when your body cannot regulate insulin, it can build up in your body and cause higher level of male sex hormone that is called androgen, as we have already talked about it. So adaptogen herbs claim to aid your body in balancing these hormones. Some adaptogen herbs also claim to ease other symptoms of PCOD like irregular menses. So first adaptogen herb is Maca Root. So let's talk about it. So the root of the maca plant is a traditional herb which is used to boost fertility and libido. Maca root may balance hormones and lower cortisol levels. It may also help treat depression, which can be a symptom of PCOD. Next adaptogen herb is Ashwagandha. So Ashwagandha is also called as Indian ginseng. It can also help cortisol levels, which could improve stress and symptoms of PCOD. Next is a holy basil. So holy basil, also called tulsi or Ocimum sanctum, you can say. So this addresses chemical and metabolic stress. It is referred to as the queen of the herbs, and holy basil can help in your blood sugar, prevent weight gain, and lower your cortisol level. Next adaptogen herb is Licorice Root. The root of the licorice plant contain a compound called glycyrrhizin, which have several unique properties, and this licorice plant has been a source of an anti-inflammatory agent. It works to help metabolize sugar and balance hormones. Next is a chasteberry. Chasteberry has been used for the centuries to help with reproductive conditions. It may improve some symptoms of PMS, that is premenopausal symptoms, and though it's effective in fertility requires, it's a very excellent medicine for the fertility. So maintaining a healthy weight can help decrease insulin resistance, regulate your period, and reduce your risk for the condition which are associated with PCOD. So if you are overweight or obese, so some studies have suggested that gradual weight loss through a low-calorie diet act as a promising first-line treatment for PCOD. So if you are obese, so work on your weight loss. Next, balance your exercise. So as we all know that exercise is a very important thing in our life. It is very important for maintaining a healthy weight, but too much exercise can disrupt your hormones. So talk with a doctor about a healthy balance. Gentle, low-impact exercises like yogas and pilates can be practiced for longer durations. Swimming and light aerobic are also recommended. High intensity interval training and long distance running help to improve symptoms of PCOD. Next, practice good sleep hygiene. So let's talk about it. So sleep affects your stress level and help regulate cortisol to balance your hormones. But sleep disturbances are twice as common for the women with PCOD. So to up your sleep hygiene, first aim for 8 to 10 hours for sleep per night. Second, establish a regular bedtime routine. Third, avoid stimulants and rich fatty foods before bedtime. Next, reduce stress. Reducing stress can regulate cortisol, and many of the strategies mentioned above, such as yoga, getting enough sleep, and cutting caffeine, and can contribute diet if you are suffering from PCOD. So foods to add in your diet or food to eat if you are suffering from PCOD. So they are high fiber vegetables such as broccoli, because it can help combat insulin resistance by slowing down the digestion and reducing the impact of sugar on the blood. This may be beneficial to women with PCOD. Vegetables such as broccoli, cauliflower, and Brussels sprouts. Second, greens including red leaf lettuce and arugula. Third, green and red peppers, beans and lentils, almonds, berries, sweet potatoes, winter squash, pumpkin. So they are some foods which are very higher foods, and they are high in fibers, and they are good for the person who are suffering from PCOD. Next, lean protein sources such as tofu, chicken, and fish don't provide fiber but are very filling and healthy dietary options for the women who are suffering from PCOD. And the food that help reduce inflammation may also be beneficial, and they include tomatoes, kale, spinach, almond and walnuts, olive oil, fruits such as blueberries and strawberries, fatty fish, high in omega-3 fatty acids such as salmon and tuna. So these are some foods which you can add in your diet if you are suffering from PCOD. Now, which are the foods which you should limit or avoid if you have PCOD? So foods which you have to avoid, let's talk about them. So foods which are high in refined carbohydrates such as white bread and muffins, because refined carbohydrates cause inflammation and exacerbate insulin resistance and should be avoided or limited significantly. This include highly processed foods such as white bread, muffins, breakfast pastries, sugar desserts, anything made with a white flour. Pasta, noodles, that list ingredient are high in carbohydrates and low in fiber, so they should be removed from your diet. Pasta made from the beans or the lentils flour instead of wheat flour are an excellent alternatives. And sugar is a carbohydrate and should be avoided whenever possible. So when reading food labels, be sure to look for the sugar's various names. So these include sucrose, high fructose corn syrup, dextrose. Sugar can also lurk in the things you drink, such as soda and juice. It is a good idea to reduce or remove inflammation causing foods such as fries, margarines, and red or the processed meats from your diet as well. So these are some foods which you have to avoid, which you have to limit if you are suffering from PCOD. So these are some natural ways to treat, to help you with PCOD. So that's all for today. See you guys in our next video. That is how you can see you guys in our next video. Till then, stay connected with us for more video like this. Don't forget to subscribe and comment below, and yes, press the bell icon for more updates. Stay safe and stay healthy. Don't forget to practice yogas, pranayams, meditation and aerobic exercises daily, at least thrice a day. And yes, thanks for watching our video, and see you guys in our next video with, that is, how you can treat permanently PCOD with homeopathic treatment.